diabetes comes in various phases of life. It also has different causes up to it. So there are genetic causes, which come from your parents, which come from the environment that you're around. It comes from what you eat. It comes from whether you move yourself or not, whether you're physically active or not. So these are the kind of things that impact whether you would be getting it or not in as you go along. Obesity definitely increases your risk for it. It also increases your risk for insulin resistance. And the initial phases, the body is able to overcome it. It You would have a rise in sugar, and the insulin is able to get secreted and take care of it. And it produces something called impaired glucose tolerance. That means your sugars don't quite become as high as what a diabetic is, but they're still very, very high. And that actually has a lot of association with what we call the metabolic syndrome, with what we call atherosclerosis, which is basically clogging of your blood vessels in your heart, which leads to heart attacks. It also causes high blood pressure. It causes all these um, what we call microvascular changes. There are small vessels in your body which basically affect the eyes, which is retinopathy. It affects the nerves, the neuropathy of your feet and your legs. And then it affects your kidneys, which are nephropathy. And as these complications keep going on, you start developing blindness, kidney failure, heart disease, and people lose their limbs. So this is the way the progression of diabetes goes until you sort of become very disabled and eventually die and succumb to death. So it's a disease where you could live with it, and sort of when it creeps up on you, it's kind of hard for it to um, disappear on its own without some kind of intervention. And cracking the wellness code and this whole association is meant for reversing diabetes. So you don't want to go into this direction at all. You want to start cutting it off as soon as you even maybe are in the early phases right here. When you start developing insulin resistance, when you start developing obesity, or you know that you have bad environmental factors or genetic susceptibility, that's the time to change.